What if your body tried to warn you, and you just didn't know the language? Every single year, nearly 800,000 people suffer a stroke. And the cruelest part? For many of them, the warning signs were already there. Whispering. Knocking. Sometimes screaming, the day before. But nobody recognized them. Not the patient. Not the family. Sometimes not even the doctor. Today, we're going to change that. Because here's what medical science now understands, and what most people are never told: a stroke is rarely a sudden ambush. In a significant number of cases, the brain sends out distress signals hours, sometimes a full 24 hours, before the catastrophic event. These signals have a name. They're called TIAs, transient ischemic attacks. But in real life, in your living room, at the dinner table, they don't look like a medical emergency. They look like tiredness. A weird moment. Something you brush off. And that brushing off, that one innocent decision, can cost everything. Let's start with something that happens far more often than people realize. Imagine a 68-year-old man sitting at breakfast. He reaches for his coffee cup and notices, just for a moment, that his right hand feels oddly clumsy. He drops a spoon. He laughs it off. Didn't sleep well, he says. His wife nods. They move on. 22 hours later, he's in an ambulance. That clumsiness? That was his brain losing blood supply to the motor cortex, briefly, temporarily, before blood flow restored itself. The technical window lasted maybe 90 seconds. But the biological clock had already started counting down. This is what a TIA does. A tiny clot, a brief arterial spasm, a momentary collapse in blood flow, and then it clears. The brain recovers. The person feels fine. Normal, even. And that normalcy is the trap. Because a TIA is not the false alarm. It is the alarm. Studies show that 10 to 15% of people who experience a TIA will have a full stroke within 3 months, and nearly half of those strokes happen within the first 48 hours. So what does that warning actually look like in a human body, on a regular Tuesday morning? That's exactly what you need to know. The first sign is one most people dismiss as exhaustion, and understandably so. It's a sudden, overwhelming heaviness on one side of the face or body. Not pain. Not numbness exactly. More like your left cheek just forgot it was part of you. A drooping sensation. A slackness around the mouth. Some people describe it as the feeling right before your leg falls asleep, except it's happening in your face, or your arm, or just on one side of your body entirely. This asymmetry is key. The brain is divided into hemispheres, and a stroke typically attacks one side at a time. So when the left hemisphere loses blood, the right side of the body shows symptoms. When the right hemisphere is starved of oxygen, it's the left side that goes quiet. One-sided symptoms, no matter how fleeting, deserve immediate attention. The second warning sign is a vision disturbance that people almost always explain away. A sudden blurring in one eye. A dark curtain that slides across the visual field and then lifts. Double vision that appears out of nowhere and vanishes in seconds. These aren't eye problems. The visual cortex lives in the back of the brain, and when blood flow to that region stutters, your vision becomes the messenger. Then there's the speech sign, and this one is haunting because it catches people completely off guard. A person mid-conversation suddenly can't find a word. Not the way we all search for a word, but a deeper blankness, like the word simply doesn't exist anymore. Or they say something and it comes out wrong. Scrambled. A sentence that made perfect sense in their mind arrives garbled on their tongue. It lasts seconds. Then it's gone. And they sit there, slightly shaken, wondering if they're just tired. They're not just tired. There's also the headache, sudden, severe, described by survivors as unlike any headache they've ever felt. Not a migraine. not tension. Something new and violent, arriving without warning, sitting behind the eyes or at the base of the skull like a thunderclap. And perhaps the most overlooked sign of all, sudden confusion or disorientation in a person who is normally sharp. A mother who suddenly can't remember what day it is. A grandfather who stands in his own kitchen looking lost. These moments aren't just aging. The brain is struggling to stay online. Now here is the part that changes outcomes. Knowing the signs is only half the battle. The other half is understanding that time is brain tissue. Medical professionals use the phrase, time is brain, literally, because every minute a stroke goes untreated, approximately 1.9 million neurons die. Not slow down. Not struggle. Die. The window for the most effective stroke intervention, a clot-dissolving drug called TPA, is just 4.5 hours from the moment symptoms begin. Miss that window, and the options narrow dramatically. Miss it further, and the damage becomes permanent. A lifetime of memories, movement, speech, gone, not because help wasn't available, but because no one recognized the warning in time. So what do you do if you, or someone you love, experiences even one of these warning signs? You use the F.A.S.T acronym, and you use it immediately. F. Face drooping. Ask the person to smile. Is one side of the face falling? Uneven? Slack in a way that wasn't there before? That asymmetry is a red flag your brain is waving with everything it has left. Arm weakness. Ask them to raise both arms. Does one drift downward without them realizing? Does one feel heavy, foreign, unresponsive? The body is telling you something the person may not even be able to articulate. Speech difficulty. Ask them to repeat a simple sentence, something like, the sky is blue today. Is it slurred? Jumbled? Does the sentence come out wrong, even though you can see in their eyes they know exactly what they meant to say? That gap between thought and words is the brain under siege. Time to call emergency services. Don't drive yourself. Don't wait to see if it passes. Don't say, let's just see how you feel after some rest. Call for help immediately, because in stroke care, every second genuinely, measurably matters. But here is the piece that truly belongs to the day before, the piece that separates a tragedy from a survival story. If someone experiences a TIA, those fleeting symptoms that vanish in minutes, they must go to the emergency room anyway. Not tomorrow morning. Not after a good night's sleep. Right then. Because the disappearance of those symptoms is not relief. It is not reassurance. It is a countdown clock that has quietly started ticking. Doctors can run imaging, identify the clot risk, and intervene before the full stroke arrives. That intervention, that urgent, proactive visit to the emergency room, is what saves people. Not luck. Not prayer alone. Action. And then there's the longer conversation, the one that happens not in an ER, but in a doctor's office, around a kitchen table, in a quiet honest moment between a parent and their adult child. Because stroke doesn't arrive randomly. It is almost always built, slowly, silently, on a foundation of unmanaged conditions. High blood pressure is the single greatest risk factor for stroke in the world. It damages arterial walls quietly, for years, before anything dramatic happens. Atrial fibrillation, an irregular heartbeat, allows blood to pool and clot inside the heart, sending those clots directly toward the brain. Uncontrolled diabetes accelerates arterial disease. Smoking constricts blood vessels with every single breath. High cholesterol builds the plaque that narrows the very pathways the brain depends on for life. These are not abstract medical facts. These are the daily, manageable, treatable realities that millions of seniors are living with right now, many without fully understanding the stake they carry. Aspirin therapy, anticoagulants, blood pressure medication, dietary changes, quitting smoking, these aren't just clinical recommendations printed on a discharge sheet. They are the actual, proven tools that keep people present. that keep grandparents at birthday parties, that keep spouses waking up beside each other. The body speaks before it breaks. It whispers before it goes silent. It knocks before the door falls down. And if we learn to listen, really listen, without brushing it off, without assuming it's just age, we can answer before it's too late. Share this video with every senior, every adult child, every caregiver, every friend who has a parent they're quietly worried about. Because the person who needs to hear this today may never search for it on their own. But you can bring it to them. If this information could save even one life, please like this video, share it right now, and drop a comment below telling us who you're sending this to. Your single share today might be the most important thing you do all week.